Good morning, everyone. Thank you, Chairperson. Today, I'll be presenting on light at the end of the tunnel, my vision. My name is Dr. Dhashani. I'm an ophthalmologist from University Putra, Malaysia. The topics that we're going to look at today include cataract, dry eyes, and glaucoma. The first topic that we're going to look at is cataract. In this picture, you can see that the lens in the center of the patient's pupil is actually white. So the lens is actually situated within the eyeball, and when we are young, the lens is clear. But as we grow older, the lens becomes opaque, or it can become opacified, where it's white. So this is actually a normal aging process. Not every single cataract needs to be operated. Most people, their cataract does not need surgery in about 90% of people, and they can just change their spectacles regularly. But in some cases, when the lens loses transparency and it is difficult for the patient to read or to see at night, or the patient has problems with glare, he's driving at night and he cannot tolerate the oncoming cars, then it's best that the patient go for a cataract surgery. So the treatment of cataracts is actually a surgery. Most of these surgeries are done as day care, meaning the patient comes in the morning and the patient's vital signs, blood sugar, blood pressure is checked. And then the patient goes in for surgery that is usually done within 15 to 30 minutes. And then the patient will be rested for about 1 or 2 hours before discharged home. Here we are also going to look at the types of lenses available and the prices both in the government and the private sector. Daycare surgery means the patient is alert and conscious and aware of the surrounding. He's not asleep during the surgery, so can listen to instructions from the surgeon. However, some cases, the patient may require general anesthesia. For an example, if the patient is very anxious or the patient is unable to lie flat due to medical conditions such as heart problem, or the patient is hearing impaired or suffers from Down syndrome where the patient may not completely understand that they're going for a cataract surgery, then in those cases, it's best that the patient go under general anesthesia. The lenses that is implanted is very small. It is about 1 centimeter in length. So when we remove the cataract, the old lens, we definitely have to put in a new lens. There are several types of lenses that can be implanted. In the larger picture on the left, you can see that the lens is very clear, and this is a monofocal lens. And in the top right corner, you will see that the lens has got multiple rings. This is a multifocal lens. So multifocal lenses allow the patient to be able to see near for reading, intermediate, driving and seeing the speedometer, and distance, the signboards. While monofocal lenses allow the patient to only see distant vision. So if the patient wants to see even their handphone, they will have to use their reading glasses. Another type of special lens that may be suggested by your doctor is astigmatism correcting lenses. These lenses are meant for basically monofocal lenses. Okay, they don't have multifocal lenses for astigmatism. Cataract surgeries in the private sector range anything from about 2,000 to 10,000 or 12,000 ringgit, depending, of course, on the type of the lenses used. Monofocal lenses are generally cheaper. Most centers will offer anything from 2,000 to 4,000 ringgit, depending on the brand that you have selected. There are lenses from India, from UK, and also Japan. While the more expensive lenses, which are the multifocal lenses, their prices are more expensive and can range also from 7,000 to 12,000 ringgit, also depending on where the lenses came from, the origin and the brand of the lenses. So what is the benefits of doing a cataract surgery in the private sector compared to the government sector? Of course, the private sector is very fast. You can do the cataract surgery almost immediately, usually within 1 week. However, if you're planning to do it in a government hospital, because there are many, many patients, you will often have to wait for a long time, anything from about 2 to 4 or 6 months. And of course, during the COVID period, because the number of cases would be reduced, some patients even have a waiting list of until 1 year. The price of doing a cataract surgery in the government sector is not free, however, you still have to pay for the lens. And the price of the lens can range anything from about 500 till 1,000 ringgit. If you are in financial difficulties, you may inform the doctor in the government hospital and they will refer you to social welfare, and social welfare will assess you to decide whether you can do the cataract surgery for free, or you may be still required to pay for some part of the lens, 30 or 50%. In the private sector, you can pay for the cataract surgery by yourself, or you may be able to claim from your insurance. So you need to check with your insurance company if you can claim for the cataract surgery. Cataract surgeries are generally uneventful surgeries, not associated with much pain, and recovery is relatively fast. If you're doing phacoemulsification, or what is known as laser, you will be able to have your best corrected vision within 2 weeks. And if it is the usual old method with a lot of stitches, that can take anything from 1 month to 3 months for full recovery. Complications are rare in cases where the patient has uncontrolled diabetes, any skin infections or infections around the eyelashes may cause the patient to develop endophthalmitis. This is a very severe infection of the eye. However, this is very, very rare, maybe 1 in 100 cases. And in extremely rare cases, as in the picture in the top right corner, some lens material may have been left behind, which may require you to go in and remove it. And in extremely rare cases as well, if your lens capsule is not stable, the lens may even fall behind. That may require you to be referred to a vitreoretinal surgeon to remove it. All these complications are rare, but still a possibility. The next condition that we are going to look at is dry eyes. This is also a very common aging process. It starts usually after the age of 50. And you may complain of gritty sensation in your eyes, smarting, and in severe cases, even tearing. So, what increases your risk for dry eye? If you have any infections of the eyelashes, then you are at risk of developing dry eyes. This is known as blepharitis. If you're taking any medication, for an example, antihistamines, for sinusitis, where it dries up your nose, it will also dry up your eyes. If your environment is very polluted, there is increased risk. There is also something known as a dry eye syndrome. If you have used contact lenses when you were younger for a very long time, more than 5 years, you're increased risk of dry eyes. Some people, they even sleep with their eyes open, then they are also at risk. Floppy eyelid syndrome is a very rare complication, rare sign of dry eyes where the eyelids is very loose. The treatment of dry eye is very, very simple. You can get over-the-counter artificial tears. If you go to any pharmacy, you will see a very large shelf. And in the shelf, there will be multiple bottles. The most common one we all know about is IMO. So the prices range anything from about 10 ringgit till about 30 ringgit per bottle, depending on what it constitutes. If you have eye drops that have sodium hyaluronate, then those are more pricey because this chemical is actually quite soothing for your eyes. In some cases, if your dry eye is very severe, the doctor may advise you to use preservative-free eye drops that come in little capsules, and each capsule has to be used within 1 day. It cannot be brought forward to the next day because there are no preservatives. Eye drops generally can be instilled anything from about 3 to 4 times a day as required. And if you're in a place where there's aircon, where the air is very dry, you may want to use it more frequently. How do you instill eye drops? It's not very difficult. You have to just tip your head back. And as you tip your head back, pull down your lower eyelid and instill the eye drop into that area inside your eye where the lower eyelid is. Try to avoid hitting your cornea because this is very painful and uncomfortable. The same thing can be applied if you're using any eye ointments, which may be suggested if you have any infection in the eye. Last but not least, let's look at another very important condition known as glaucoma. Glaucoma develops in the elderly due to a blockage in the drainage of the fluid within the eye known as aqueous humor. While its development is constant, its drainage may be blocked due to various conditions. Therefore, the pressure inside the eye will increase, and when the pressure increases more than 20 millimeters mercury, you are at risk of developing problems with the optic nerve due to this pressure. In the picture on the left-hand side, the optic nerve is healthy, normal, pink. And on the right-hand side, you can see that the optic nerve is very pale and unhealthy. This is the glaucomatous optic nerve. Unfortunately, glaucoma, which is also known as the thief of sight, is most commonly in 90% of patients a painless, slow loss of vision. So most patients come in late when they have lost significant and permanent loss of vision. In rare cases, there's another form of glaucoma known as angle closure glaucoma. This affects 10% of glaucoma patients, and here it is very sudden and very painful, and the eye is red. So on the top left corner, you can see what a normal person would see. This is normal vision. In early and even in an advanced stage of glaucoma, most patients are unable to appreciate the loss of peripheral vision. And at late stages, they will see like as if they're looking through a small tunnel. And in very advanced stages, they will finally lose their eyesight altogether. Therefore, it is very important to start screening for glaucoma after the age of 50, at least every 2 years, because it is silent. And most patients only come in at a very advanced stage, and whatever is lost in glaucoma cannot be recovered. If you have a strong family history of glaucoma involving your parents or your siblings, it would be advised for you to check your eyes at least once a year. In most cases, glaucoma is treated with just eye drops. 90% of the patients respond to just using eye drops. The patient usually just needs 1 bottle. But in very rare cases, some patients may need up to 4 bottles per day to control their intraocular pressure. And if 4 bottles is still unable to control the intraocular pressure, then the doctor may suggest a surgery known as trabeculectomy. So in trabeculectomy, a cleft is made on the white part of your eye, known as the sclera, which drains out the fluid into a space below your conjunctiva. So in the picture in the bottom left corner, you can see like the conjunctiva is ballooned up, and that is actually the fluid from within your eye that is draining out into the subconjunctival space that will be later absorbed. In patients who develop the painful form of glaucoma, known as angle closure glaucoma, the treatment is relatively easy. They come in for a simple procedure known as laser peripheral iridotomy that is done within about 5 to 10 minutes. In the bottom right corner, you can see that there's a small tiny opening where the arrow is pointing, and that opening allows the intraocular pressure to be reduced in these patients. So thank you very much, everybody. I hope I have been able to help you understand more about cataract, dry eyes, and glaucoma. And I hope that all our patients who are elderly are able to see well into their final years. Thank you.